When times are hard, one of the most important things to do is be able to ask for help. And with COVID and quarantine, so many people in the United States and around the world are reporting severe feelings of anxiety and depression. Therapy is a fantastic resource, maybe today more than ever. But if you kind of think about it for a minute, the actual process of psychotherapy is a little strange. It's kind of a black box. Two people walk into a room together, and for a while they talk, and one of them walks out feeling better. And not just feeling better, but maybe having something really fundamental about their nature change in some really important way. The overwhelming majority of studies have found that psychotherapy helps people. And some studies have found that it's just about as effective as medication for treating depression, and often without including some problematic side effects. There's some evidence that suggests that cognitive behavioral therapy is particularly effective for treating depression, but generally speaking, no form of psychotherapy has been consistently found to be better than any others. So there's reasonably good evidence that therapy works, that it actually helps people change how they use their brain in meaningful ways. But how does it do this? Well, the dirty little secret of the helping professions, and therapy in particular, is that we really don't know. In a somewhat bizarre twist, therapeutic outcomes, that is, how effective therapy is, doesn't seem to be correlated with how experienced the therapist is, or even whether the therapist is a student or a professional. There's even some research that shows that young college students with no training in psychotherapy whatsoever can be more effective than trained clinicians under very specific circumstances. And this flies in the face of everything that we think we know about the way that teaching and learning works. If there's something that the therapist is doing, broadly speaking, that's changing their client in a meaningful way, shouldn't an experienced therapist be better at this than an inexperienced one? Shouldn't that therapist get better at doing whatever is changing their client over time? What could possibly be happening here that isn't really improved by years of training? And this question of what differentiates good therapists from bad ones, or how does therapy work, it can sound kind of abstract, but it's a really good proxy for a bigger question. How can we help people change in lasting ways, even if it's just through content like what I'm doing here on YouTube? What really matters here? It turns out that there is one thing that's been consistently shown to affect how good somebody's outcomes from therapy are. It's the strength of the alliance formed between the therapist and the client. This frames treatment as a kind of collaborative relationship that both the therapist and the client buy into. They hold mutual goals, and they hold each other in mutual positive regard. Or, in plain English, you get a strong alliance when the therapist and the client basically like each other and are on the same page. And we can use this to actually further validate the research that decouples experience from outcomes, because it turns out that research has shown that more experienced therapists are not necessarily better at forming strong relationships with their clients. Regardless of how experienced the therapist is, empathy is a key factor, not just in forming a strong alliance, but across a host of measures of how effective therapy ultimately is. This, to me, creates more questions than answers. Why aren't experienced therapists better at being empathic? Or maybe at the furthest extreme, are all of these elaborate structures that we've created over the last 100 years or so really no more useful than just being with an empathic listener? One of the best books that I read recently was Maybe You Should Talk to Someone. It's by Lori Gottlieb, and it details her experience both being a therapist and going to see one herself. It's an awesome book. I'd recommend it to just about anybody, and she had a line from it that particularly stuck with me. To paraphrase her here, she highlights the importance in therapy of being able to sit with another person in their pain. And on the flip side of that, as a client, to have the experience, the feeling that somebody else is comfortable sitting with you in your pain without trying to move it to become something else. Essentially, the therapist isn't overwhelmed by your feelings, and they're not telling you that what you're experiencing is wrong. They're just abiding with you in that space until the feeling naturally transforms to become something else. And speaking personally, this dovetails with my experience in therapy as well. One of the most healing parts of the whole process can be just the sensation that somebody else is willing to sit with you in your moments of discomfort, rather than trying to rapidly move you to some other place. And once you have the experience that somebody else is capable of meeting you in that emotion, wow, that can form some real genuine trust between two people. Having both gone to a therapist myself and had plenty of conversations with really empathic friends who are good listeners, I can say anecdotally that it feels like something really different is happening during therapy. And then there are some specific techniques like EMDR that I've found really personally useful, though admittedly that could be a function of set and setting as much as anything else. One of the things that really changed how I thought about therapy recently was thinking less about a therapeutic session and more about having therapeutic moments with other people. It's really possible to have a therapeutic moment with a good friend. But therapy provides a unique opportunity for a concentrated dose of therapeutic moments, and that can be really valuable for people. And if you want to really be a great friend to somebody, particularly a great friend to somebody who's going through a hard time, see if you can sit with them in their experience without trying to change it. Without judging it, without telling them why it actually isn't that bad, without being solution focused, whatever, all this stuff that can be good a lot of the time. But in that moment, sometimes it can be just incredibly healing to really experience that somebody else is able to meet you exactly where you are. So that's it for today's video. If you enjoyed the video, I'd really appreciate it if you would subscribe to it and maybe even hit the like button. It lets YouTube know that you liked it, and it really does help me out. So until next time, thanks for watching.